Brandon Brandon Ashley did a great job setting this up.
All right. Well, thanks, Dr. Hall, and thanks, Ashley, for setting up this great webinar. This is very important to me because I'm leaving a space with tons of people. I've been worried the whole time about flu and COVID, and do I get my flu shot early? Do I get another COVID shot? Can I get a new COVID shot? What's up with RSV? All of these things. And so this is an appropriate or better than appropriate time to do this. And the best person to lead is Dr. Laura Lee Hall. I don't know if you guys know, I mean, obviously you heard her speak and her team speak about this, but they have been leading on this effort, whether it be COVID or flu vaccinations, at least since I've been working at NMQF with a variety of partners. And so if there's somebody that you need to learn from and hear from on this, it's Dr. Hall and her team of experts that are coming. I just want to give the housekeeping so she can go in and give go right into the meat and potatoes of the discussion. If you have a question that you'd like to ask, please put it in the Q&A box. And if you just want to kind of put your own thoughts or some links to any program that you want other folks to know about, please put it in the chat function. But that's all I have. Dr. Hall and team, please take it away.
Oh, thank you so much, Brandon. And thank you everybody who's here on the August 23rd, Friday. Is this the last Friday of the month? Unbelievably. I'm gonna put up my slides here so we could just jump right in. And I presume everybody can see my slides. Yes. So this is what we're talking about. What's up and new with flu and COVID and RSV vaccinations this year. And you see we have an amazing panel here. And I am not going to give you an introduction of them. I have asked each of them to talk about who they are before they begin their comments and talk about what really has made them excited to be a vaccine champion and expert. But if they are too modest, I will jump right in there. I am the founder and president emeritus of SHC, which is part of the National Minority Quality Forum. So let's go in. I mainly want to give you, with my comments, a sense of what has happened in the last flu season that NMQF has been working on with partners around the country. We call our program DRIVE, by the way, and been working on all kinds of vaccines, but certainly flu has been at the top of the list, and others. I just want to look at the scope of the partners we have worked with. We've been in 25 states this last year. We've worked with 43 churches, 15 stylists and barbers, 155 clinics, and 215 pharmacists. So there are a lot of folks who've been working on this with us, and we're so proud of them. What are our programs? We have Drive, which is really a free online kit, as well as an activity that we can work with you in terms of helping clinics improve their vaccine rates and vaccine equity in their practices. It's very straightforward, easy to access, and you'll see it's been quite impactful. We have a network of churches, brown and black churches around the country called Faith Health Alliance, who've been really working hard for 3 years now in promoting vaccines. We have a network of community pharmacist ambassadors. So 2 of our presenters today are pharmacist leaders, and they're such a critical profession in promoting vaccination. We have our hair wellness warriors, who are people in their community who care about the health of their community, and thus have been doing educational programs, and partnering with providers, like from the clinics, like from pharmacies, like from the health department, to get vaccines to their customers and community members. And then our Health Champions program, which is about to relaunch, has a number of resources that you can use for educational purposes in your clinic, pharmacy, and community. So I wanted to just give you a sense of the last year. So this is flu season 23-24, and this is the year before it. And I'm not going to read all of this. You see the big health systems and organizations we've worked with. Last year, and this is a very modest estimate, we didn't try to go too big here. Our partners were responsible, who were in the program, for giving 175,000 flu vaccines. And while we didn't have every one of them for the year before, we did see at least an average of 10% increase in flu vaccine rates. Some were much bigger than that. So who are these partners? There is the wonderful Elmhurst NYC Health and Hospitals in Queens. I'm not going to read this all to you. I'm glad to share my slides with you, and this is being recorded for you to share with your colleagues as well after today's event. But they were able to achieve some excellent results, and it's a multifaceted, multi-month program where they do vaccines in the community on a regular basis, not one and done. They have vaccine flu fairies who actually go to the clinic staff and give the vaccines to those working folks in the clinic right where they're working. This is Helen Chang, who is the amazing CEO. And you see here they did some activities associated with Christmas. Okay, so they had a 10% increase in their patients and community in terms of participation in this program. And they had a 60% increase among their employees. We had the great good fortune of partnering with Dr. Jasmine Gonzalvo at Checky at Purdue University Pharmacy School. We had an all-day summit in December, and the lunch period was actually a virtual period. So here's everybody there in the great state of Indiana. And here's who we were on the webinar. We were able to engage 215 pharmacists last year. This event's going to happen again this year in the first week of December, so stay tuned. Our Care, another partner we've been working with for multiple years now, they are a FQHC with 60 primary care clinics in 4 states. They were really proud this last year. They added in community vaccination activities, and here they are in Mississippi. They've been increasing their rates every year, by the way. Last year, the Southeast Medical Group was new to the DRIVE program, and they had engaged, recruited 45 of their clinics. So this is in Georgia, northwestern Georgia, and almost every clinic did better. You could see here, some clinics did a lot better. And here's the number of vaccines given. This was a group that wasn't even going to vaccinate at their sites before joining the DRIVE program. This is Dr. Peter Alate, who actually presented. He's an internist as part of the Southeast Medical Group, and he presented at our NMQF Summit virtually and is a great champion. Our program partner, Walgreens, has been enormously important in helping our community partners like the Faith Health Alliance, the salons, the barbershops, and the free clinics actually access vaccines and vaccinators. And you see they participated in 33 events. So hats off to Walgreens. I'm not even going to read this. We did a lot of things with them. This program, however, is the Faith Health Alliance. Okay, so these churches had 50 events with over 2,200 vaccines given. I want to point out that these wonderful champions for health in their community, they were taking advantage of all kinds of activities, fall festivals, Christmas celebrations, NAACP parade, a vaccine clinic in honor of Black History Month. I mean, they really were continuing to promote and educate about vaccines, flu vaccines, and others. So they were offering a lot of different vaccines at their events. They do pop-up events in non-traditional locations, which was really critical with COVID. And they, getting the word out These are great champions. Here's some of their materials and pictures that you can see. These are the hair wellness warriors, and Leslie from our team is on the call, and she leads them, and she helped develop the materials for the 15 stylists and barbers who participated. And I just wanted to give you a flavor of the tools we made available to these folks to develop their own presentation materials. And you also see here, they offered a number of vaccines. This is just a summary of the other really great partners, giving you an idea about who you can work with. So Michigan United is a statewide coalition that works on a number of issues, and they were so great in promoting and getting vaccines in the arm. We have College Park Pharmacy working with one of our churches. The National Association of Free and Charitable Clinics. I mean, these are the folks who really are taking care of our uninsured population. And there are 1,400 plus, I think even more now, clinics around the country. And they were promoting it at their national meeting, and they had a number of clinics that did outstanding work. The Daily Planet, which is a multi-site FQHC in Richmond, Virginia, really serving some of the most vulnerable people in that community. You see the South Carolina Association of Community Action Partnerships. They partnered with Walgreens, and really, this isn't the core of their work, but they were so absolutely committed to helping seniors and other vulnerable people get vaccines last year. I'm kind of ending with this example. This is the third year now that Healthy Hearts Community Prevention Program, working with multiple partners, including Bright Moments, the City of New Orleans, Health Department, Tulane, and others. And forgive me if I'm not mentioning every single person or organization they work with. This is a massive communications campaign. So you could see flyers, videos, social media, banner ads, email marketing, billboards. So this is a billboard, and the great Dr. Keith Ferdinand was on it. I mean, I wanted to go to New Orleans and drive down that highway so I could see the billboard. You see this big number? They were able to give almost 90,000 vaccines last year. Each year has been an increase, 25% increase over the previous year in the African American population. I'm going into detail because on September 27th, Daphne Ferdinand, who heads up Healthy Hearts, is going to be leading a webinar September 27th at noon, talking about how to put together a successful campaign. So we're going to move right on now to the fantastic Dr. Beysolow, pediatrician, vaccine expert, director of health ministry at the AME Zion Church. Then we will hear from the really talented pharmacist, Dr. Helen Chang, who now is a coordinator of the Accountable Care Organization. Hint, hint, ask your reimbursement questions. But she also did a lot of work in the community that she wants to talk to you about. And Seah Han, another pharmacist who works at NovaScript Central, who is a partner of ours for all of our pharmacy work, is going to talk about our resources. Again, I'm asking each of them to say a little bit about what brings them to this project and this topic, and I will embarrass them if they're too modest. So let me stop sharing.
All right, thank you, Laura Lee. Now, can everyone see the slides here on my speaker notes? Which one?
You're good.
I'm good. All right. Welcome, everyone. And let's give another round of applause to all the community champions and trusted messengers that Laura Lee shared with us, and all of you who are listening in today. You're the ones on the ground doing this wonderful work, and we say thank you. We're just here to support you. I'm Yabo Beysolow. I'm a pediatrician and also have public health experience. I worked at the CDC for several years in the Immunization Services Division. I currently consult for NMQF and other organizations, and that's my passion, really sharing as much information we have about vaccines for national entities, for the general public, for clinicians, going into clinics, helping them, et cetera. So I love doing this work. I'm also currently the Director of Health Ministry for the AME Zion Church. So that allows me to really be in touch with the public and really, again, share knowledge, address misconceptions about vaccines, et cetera. So with that being said, we're going to go ahead and delve right into today's presentation. I'll go over an overview of what's happening currently with regards to respiratory illnesses. Then we'll talk about the specific vaccine updates. Please put your questions in the chat so that we can address them. So let's start off with what's going on as far as messaging and campaigning. So the Department of Health and Human Services and CDC have put together this wonderful campaign called Risk Less, Do More, and it's really putting us in that frame of mind. We should be promoting all three vaccines, RSV, COVID, and flu, for this season. And this campaign is targeted to the general population, but also reminding us that we want to make sure that we're protecting our older adults, pregnant people, adults who live in long-term care facilities. So great campaign. We've shared the links in the chat with you for all of these slides, and also you'll get the slides at the end as well. Many of you also remember that CDC also has some prevention strategies that they've been promoting since earlier this year. At the core of these strategies is, of course, staying up to date with immunizations, but also remembering practicing good hygiene, making sure that we're opening windows, especially as we come into the fall where we're in close spaces, taking those steps for cleaner air. When people are sick, reminding them to stay home until they're well so that they can prevent spread, seeking healthcare promptly if you're getting worse, and then testing to treat especially if you're at risk for severe illness. And sometimes it may not be COVID, but it could be the flu. And it's so important, especially those who are at higher risk for severe complications from those illnesses, get treated as soon as possible. With Paxlovid, for example, for COVID, with Tamiflu for the flu. And then also reminding our communities, masks are still part of the toolbox, the toolkit that you have, physical distancing, and making sure that you test. Many of you, I'm sure, many of you trusted messengers out there, community champions, you probably already have some of these messages, especially from earlier on in the pandemic. And we want you to dust them off, brush them off, resurface them, repurpose them, and continue to spread these messages, these core prevention strategies. So why are we even talking about these strategies? As we approach the fall and winter season, we expect to see a rise in COVID-19. We expect to see a rise in RSV and flu, but also because right now, unfortunately, we are seeing a rise in COVID-19 cases, how many people are testing positive. You can see those little graphs there across the screen. We're seeing an uptick in people going to the emergency department due to COVID. Hospitalizations are increasing, and unfortunately, deaths. So we're still learning what's the pattern of COVID-19. Yes, it's like flu and RSV, but those are usually fall and winter only. But we're starting to see with COVID is summertime as well. So we must remain vigilant pretty much all year round. This is another tool that we encourage you to download, have on your desktop at work, and it gives you an idea of hospitalizations. Yes, we're worried about people coming down with any of these illnesses, but are they sick enough to be hospitalized? That's what we're really concerned about. That's what we're trying to prevent. That's why we vaccinate. And so this is really a snapshot that you can look at from time to time. And again, we see the COVID-19 rates in the red are the ones that are rising the most. So let's turn our attention now to flu vaccines. You've all heard this. It's more than just a cold. And we can see by the numbers here that that's true. But I also want you to look at this, not in terms of just numbers for statistical purposes. These are people, these are lives, and millions every year. This is from October 2023 through June 15th of this year, just one flu season. Look at the millions who came down with the flu, the millions who had to visit a healthcare facility because of the flu, the hospitalizations, over hundreds of thousands of hospitalizations, and unfortunately the deaths from the flu, tens of thousands. So from the Census Bureau, if we look at a city, say like West Haven, Connecticut, Plainfield, New Jersey, that they have about 50,000 people. So that's a lot of deaths from the flu just in one season. And when you look at COVID-19, 2023, we had over 70,000 deaths from COVID-19 alone. So we have work to do, guys. And I know all of you are already doing this great work. So how can we support you? What's new for flu vaccines? So for the 2024-2025 season, flu vaccine, we continue to recommend it for everyone 6 months of age and older who do not have a contraindication, such as a severe allergy to the flu vaccine. The vaccines this year are trivalent, meaning that they're going to protect us and they're covering those 3 strains that scientists believe will circulate. Used to be 4 strains, but because we have not seen the influenza B Yamagata virus since 2020, scientists felt it was best to just stick with the 3 strain protection for this season. So again, you may wonder, why get the flu vaccine? I'm sure you hear that question all the time. Yes, again, we're worried about people catching the flu, but we're even more worried about those who get sick enough to either have to seek care or be hospitalized. And the flu vaccine, study after study, has shown that it does decrease your risk of having to go to the doctor by 40 to 60%. And getting a flu vaccine also means that you're 40 to 70% less likely to be hospitalized because of flu or its complications. We especially want to remind clinicians who treat our older adults and all of you trusted messengers in the community. Adults who are 65 years and older, they should preferentially be receiving the high dose or adjuvanted flu vaccine. That means the stronger than the standard dose. And why is that? Because as we age, our immune systems are just not as robust. And studies have shown that these 3 vaccines are potentially more effective than the standard dose flu vaccines. Also, in June of this year, ACIP made a recommendation that these same high dose or adjuvanted vaccines, these are acceptable options for flu vaccines in people 18 through 64 years of age who have either received a solid organ transplant or those who are on immunosuppressive medications. So who can get a flu vaccine? Again, anyone 6 months or older without a contraindication. You have 2 options. The flu shot, and that's for everyone 6 months of age and older. And then there's also the nasal spray flu vaccine. This vaccine is recommended for healthy individuals 2 through 49 years of age. It is not, however, recommended for pregnant people. It is not recommended for people with certain medical conditions. For example, people whose immune system is compromised. So it's best to always talk to a healthcare provider or pharmacist, find out which option is best for you. Now let's turn our attention to COVID-19 vaccines. Hot off the press, many of you have already seen the news reports that yesterday the FDA approved the new 2024 to 2025 updated mRNA COVID-19 vaccines. Those are the ones made by Pfizer and Moderna. We're still waiting to hear about Novavax and whether that will be approved. So it's the same, made in the same process as prior mRNA vaccines. Nothing's changed about the process. What's different is that it's been updated to target the variants that are circulating right now. The KP2 variant, some of you may have heard it called the flirt variant, etc. Who should get this vaccine? Everyone 6 months and older is recommended to receive this new updated vaccine. That includes if you've had the vaccine before, the older versions, and it also includes those who've had COVID-19 illness in the past. So we'll talk about that shortly. When will it be available? Back in June, when the ACIP met, they said that within a couple of weeks of FDA's approval, we should start expecting to see these vaccines in offices. So look out for them. Hopefully you have your flu vaccine, so now you're waiting for the COVID-19 vaccines. So question you may hear, when the new vaccine is available, when should I get it? What should I expect? So we're waiting for CDC. I've been on their page up to a minute before this presentation, guidance on when you should get the new updated vaccine. FDA printed yesterday that if you've previously had a COVID-19 vaccine, you want to wait at least 2 months since that dose to get this new 2024-2025 vaccine. So we're waiting to see that in writing from CDC as well. And I'll share the link with you. It's in that list of where you can go to get that updated guidance. Another issue is if you've recently have COVID-19 disease, should you wait? And CDC has said on their website, it's best to always wait about 3 months after the illness, because during that time, you probably still have some immunity, some protection, but we know that immunity wanes over time. However, if someone has a serious chronic medical condition, or say they plan on traveling internationally, they may need a dose earlier. So it's best to talk to a provider to see if you need to wait 3 months or you can do it earlier. Another issue is that we're coming up again pretty soon. I can't believe it. Thanksgiving's coming up soon. You want to make sure you're protected before the holidays and spending time with families. So you want to make sure you have that vaccine in your arm before then. And then also, as far as what to expect, similar side effects to those who've had the mRNA vaccines before. You may have a sore arm, fever, headache, chills. So those are all things that you will still expect. So why was this vaccine needed? So I think we have a minute. Leslie, would you mind queuing up the video for us? It's just a minute. It does not have sound, so you'll have to read across the screen. And I think this will help you see why viruses mutate. Thanks so much, Leslie. And we know that viruses try to always evade us. They don't want us to gobble them up, basically, our immune system. So they're always changing in an attempt to do that. So we'll give it another second. And if not, we have the link in the chat if we're not able to queue up that video. Any luck, Leslie? Okay. All right, let's go ahead. No problem. Let's go ahead and continue sharing. And let me know if you can still see my screen. Can you see it?
Yep.
Great. All right. So it's a great 1 minute video you can watch on your own, just explaining variants. But variants, again, exist. Think about a tree with branches, and the variants are basically branches from that original strain of COVID-19. This is a really busy slide, but it's really showing you that the current circulating variants are the KP, the JNs, et cetera. And then we also, remember we had that original strain, which is that tree bark, the really big tree. And then since then, we've had those branches, those variants, like the JN1, and then also the KPs now. The reason for this is just to show you that everything originated from the original vaccine. So yes, the vaccines we had in the past helped us for those earlier strains. They may still provide some protection because they're still connected, right? So they may still provide us some protection, but to get the best protection, the CDC, FDA felt that we needed a vaccine that would target what's currently circulating, those KP2 strains, and then offer cross protection for the KP3, which is now taking the lead. Okay, so again, why is it important to stay up to date with these COVID-19 vaccines? People who are up to date, in studies are showing this, they have a lower risk of severe illness from being hospitalized and dying from COVID-19 versus those who are not vaccinated or who have not completed the doses recommended for them. So when we look at some of the data here, just concentrate on the far right of the slide for a minute. 11%, only 11% of those 18 years and older hospitalized over the last season had received the updated 2023-2024 vaccine. That means most of those hospitalized had not received that vaccine. And over half of hospitalizations among those over 18 had not received a COVID-19 vaccine since August of 2022. So basically they had been unprotected for over a year. So that again shows that vaccination, staying up to date, it really does work, it helps. So when are you up to date? Again, just did this screenshot right before we came on. This is currently on the CDC site, and I'm just going to concentrate on adults because for kids, they may need multiple doses. So just for adults, you're up to date when you've received the new dose of the 2024-2025 Moderna or Pfizer vaccine. If you're 65 and older, at this point, you also only need one dose. An additional dose is not recommended. That was last year's recommendation. So this is new for this season. So unless you're moderately or severely immunocompromised where you continue to need multiple doses, one dose for everyone 12 years and older at this point. So this is where you can find all this new guidance, and it's being updated as we speak. So we encourage you to follow these and keep these on your tabs. Then RSV vaccines for adults, just quick recap. There are 3 RSV vaccines licensed by the FDA. CDC recommends that all adults 75 years and older get an RSV vaccine. So this is different. So last season, there was a shared clinical decision-making where those over 60 could receive the vaccine if they wished to, if they chose to. So CDC this year in June voted on these recommendations. All adults 75 and older get the RSV vaccine. If you're 60 to 74 and you have an increased risk of severe RSV disease, that means you have maybe chronic heart or lung disease, weakened immune system, you have other medical conditions, live in a nursing home or other long-term care facility, it's recommended you get the RSV vaccine. But if you're not in these increased risk group, it is not recommended if you're 60 to 74 to get the RSV. But again, everyone 75 and older recommended to get the RSV vaccine. If you've had the RSV vaccine once, you've already received a dose, you do not need another dose. Best time to get vaccinated, when's that? Late summer, early fall, before RSV starts to peak in your community. For babies, our goal is protecting our babies and very young children from RSV. For those of you who see children as clinicians, you know that this can be devastating. Even for in the general community, you may have seen children hospitalized needing oxygen because of RSV. It can really affect our babies. And so there are 2 ways we can protect them. First way, give the baby ready-made antibodies. Those are the fighting cells. So they don't have to make those antibodies themselves. And that's in the form of something called nirsevimab, which is a monoclonal antibody. Another way we can do this is give the pregnant mom a shot. You give the mom the shot, her immune system then develops antibodies or fighting cells. She passes them on to the baby. Now the baby's protected. So 2 ways we're trying to really protect our infants and very young children, certain young children from RSV. And then we must not forget our special populations. We want to remember when we're prioritizing who to call in to vaccinate early, get folks in, our older adults. Remember I said our immune systems do not work as robustly as when we were younger, and we're also more likely to have underlying health conditions. So prioritize older adults. Young children, their immune systems are still developing, and also their airways are really small. These viruses can really attack that. People with weakened immune system, we may not build up immunity or protection as well, even with vaccine. That's why we need to prioritize and may need extra doses of the COVID-19 vaccine. People with disabilities, because of living sometimes in congregate settings or having underlying medical conditions, social determinants of health that affect or increase their risk, people who are pregnant, recently pregnant as well. So best practices, I only have a minute, just wanted to celebrate you as trusted messengers. Again, we know there are disparities in flu vaccine by race and ethnicity. We see at least a 7 to 9 point decrease in our African-American and Hispanic communities versus our white counterparts. Likewise, with COVID-19, we also see very low rates across the country, but we see disparities in uptake of the most recent COVID-19 vaccine in African-American and Hispanic communities. So what can we do? Well, you have the power. If you're a healthcare provider, your recommendation sticks. Study after study has shown, regardless of race or ethnicity, providers, when you tell people that they need to get their flu vaccine, they listen to you and they follow through. So continue recommending your vaccines. And there are standards that healthcare providers can use when we're vaccinating. We want to assess at every encounter. We want to recommend the vaccine. We want to administer or refer out if you don't necessarily have it, document, but also remember you can use standing orders in your settings. Remember to recommend all 3 vaccines, COVID, flu, and RSV. And then there are QI initiatives that you can institute in your settings, small projects, and we can share more of these with you. For example, you could assess your coverage levels at baseline. And then you could say, well, let's set up a nurse schedule where patients can come in, doctor doesn't have to see them, the nurses give vaccines every Monday, Wednesday, Friday. Do that for a month, come back at the end of a month and look at your rates. Did they change? So we have several examples, but I will stop there in the interest of time and turn over to my colleagues. Thank you so much for your attention.
Thank you so much, Dr. Beysolow, for all that information. Again, this will be available to everyone. And I see that Dr. Chang has been answering questions in the Q&A. Thank you so much, Helen. I'd like to turn it over to you now and share some of your wisdom about getting these rates up.
Okay, great. Thank you. Let me just share my screen here. A moment. All right. Can everyone see my screen?
Yep.
Okay, great. So my name is Helen Chang, and I am currently an employee of Centers for Medicare and Medicaid Services. But prior to that, I was a pharmacist for 10 years with the Indian Health Service. And in that time, I wore many hats. As those of you who have worked in rural places know, you tend to do that there. And I had the privilege to operate a pharmacist outreach program where I was responsible for leading a team of pharmacists and technicians and boosting the community's immunization rates. So as such, I'm going to be talking about that from my experience with the boots on the ground experience. Yeah, let's see here. Sorry, my Zoom is being weird. Okay. All right. Okay, so for us to have the biggest impact on prevention of respiratory illnesses this cold and flu season, we need to ensure that as many people as possible receive the available vaccines. To do this, we need to increase access and address the barriers in getting these vaccines. First, let's talk about interventions that can be done inside of the healthcare facility. So this could be, this is anywhere a patient might already be going. We should be using every visit, we should be using every visit as an opportunity to offer immunizations. The Indian Health Service had a great campaign last year called the E3 campaign to boost immunizations, meaning every vaccine, every visit, every visit, every patient, every recommended vaccine. This idea aligns with the idea of offering convenience. We implemented this by offering vaccines at each setting. For doctor's appointments, this could be screening, including a question on the pre-screening sheet that patients fill out prior to appointment, where they're asked if they would like to receive vaccines at this visit. That gets the ball rolling, and that way the rest of the care team can work together to have those ready when the patient gets in the room. In urgent care, if you have support from pharmacy, you can store immunizations and medication dispensing cabinets, and implement a similar process of offering vaccines during triage if appropriate, considering the patient's presenting condition. Hospitalizations are also a great opportunity because you have a captive audience and you can add vaccines to the discharge procedure. Pharmacists and technicians can assist in this setting by doing medication reconciliation and checking immunization records to confirm eligibility and history. Community and retail pharmacies are already doing a great job with advertisement and deliverance of immunization services. These pharmacies are a great resource because of the high amount of traffic that comes to grocery stores with pharmacies and drugstores, offers visibility, familiarity, convenience, and typically typically offers appointments, but it also takes walk-ins so you can be spontaneous as a patient. If your facility has an outpatient pharmacy, this can also be a great place to offer vaccines. So to give you a picture of how this looked in our community hospital, which included outpatient and inpatient services, patients would come into the doctor's appointment and someone asks them if they want vaccines. If they don't get it there, they go to the outpatient pharmacy, fill their prescriptions, or they happen to go there for refills. Pharmacy staff asks them if they want vaccines. They go to the urgent care, ER, same thing. They go back out to the ER pharmacy, same thing. Basically, you can not step foot inside any part of the facility without being offered a vaccine at some point in your journey. And how were we able to offer vaccines at each of these settings? Well, we made sure that vaccines were readily available at each station and utilized our medication cabinets, such as Pyxis or Omnicell. Then for the administration portion, we really understood that nursing staff can already be strained by existing responsibilities. So we use pharmacists and pharmacy technicians to go to each location to administer and then to document the immunizations. If you work in healthcare, you know, documentation is often half the struggle. And then expanding operational hours during cold and flu season can also be great to help patients that might not be able to come in during business hours due to work or other responsibilities such as caregiving or a plethora of other things. Let's see. Another great way to improve access is to expand the settings where you're offering immunizations by going to the community. I ran an operation where we set up a community vaccine events using either a portable refrigerator, an SUV, or our medical mobile unit. Some of the big impact places to set up include local employment places, community centers, gathering places, and schools. High school sports stadiums and commercial centers were great places to set up for large public health fairs. And now even retail pharmacies such as CVS are offering mobile clinics to services to employers. We had an agreement with the local school district to be able to come in and vaccinate students and staff. Though for minors, you do have to keep in mind this does require a lot of advanced work with advanced consent forms from parents and guardians and pre-screening immunization histories. Then home visits, which were the most time-consuming type of community outreach, but we used them to target the toughest population to capture, which included children under 3 who were behind on immunizations, those who live in children's shelters or adult group shelters, and incarcerated persons. This was especially important because most small DOC operations don't have dedicated medical staff and requires correctional officers to bring people in to get these services, and they're often just as short-staffed as healthcare staff are most of the time. All right, now I know what you're thinking, my clinics and pharmacy are already so busy, how am I gonna make this happen? So my advice is to leverage your billing department and pharmacy technicians to capture revenue and to use reimbursement opportunities to justify additional staff. And let me really emphasize pharmacy staff and pharmacy technicians here, maybe because I am one. But to give you a little history, back in 2016, Idaho was the first state to introduce the idea of pharmacy technicians administering immunizations. I mean, it laid the foundation of what's happening now. And one of the silver linings of the pandemic was that the PrEP Act gave us all sorts of flexibilities. One of those was allowing technicians to immunize in all states. And though the PHE is now over, it did set a precedence and create a whole army of techs that are now trained to immunize at this time. And while state laws still vary on that at this time, those trained techs already do exist. So it's important for us to advocate for them to continue these, since they've proven themselves to be more than capable and crucial to the COVID vaccine response. My program started training technicians to immunize back in 2017, and the years that followed generated enough revenue to justify their positions more than 10 times over, and increase our community adult and childhood immunization rates dramatically. Let's see. Okay, and preventive health is great, and especially great because everybody wants to pay for preventive health services, right? Most healthcare plans cover all immunizations recommended by CDC without cost sharing. This includes Medicare Part D, marketplace plans, state Medicaid and childhood health insurance plans, and private insurance plans, as long as the provider is in network. Additionally, Medicare Part B covers flu and COVID vaccines and reimburses at 95% of the AWP. Here are some cash prices I found through websites of popular pharmacy retailers. As you can see, for most people who are uninsured, cash prices can be quite steep, and these pharmacies are charging for close to what I imagine their acquisition cost is when you compare them to the AWP. So it's likely that most uninsured persons will not be able to afford to get these vaccines at these places. So here are some resources to assist. The National Associations of County Health Officials website is a great resource because most local health departments offer flu and COVID, and sometimes even RSV at low to no cost, though their supply can be limited. This website contains links to health departments by county. Immunize.org offers links to resources and policies by state, and is a great resource for any healthcare provider because it can answer any question you could possibly think of regarding immunizations. And the CDC's Bridge program for COVID vaccines unfortunately ends in end of this month, and there's new future updates for continuing from CDC at this time. Vaccines for Children program provides free vaccines to children 18 years and younger who qualify for Medicaid and CHIP, the uninsured, and all American Indian and Alaska Native individuals. And they do provide the healthcare facilities the vaccines at no cost to them. And lastly, we need to consider why individuals are uninsured. In a system, if applicable, to apply for either Medicaid or healthcare.gov is a starting point for healthcare insurance marketplace plans where you can qualify for if you don't have any other types of insurance. And then to conclude, we should all be working together to help protect our community's health by engaging our community members, accepting the unique opportunities that come to us, and meeting patients where we are. We should be creative in our solutions, and most importantly, be building relationships, because everyone's got something unique and unexpected to offer, and that sense of connectedness is what drives communities to thrive and grow. And you get the opportunity to see cute little yard dogs like this if you go out in the community. So, perks.
Helen, thank you so much. I can't more strongly emphasize working with your community partners can be really critical. It can help you if you need access to vaccines. So your health system, your health department, your local pharmacy, they can all be of help with that. And if you're a community organization, the experts who are in the health systems, health departments, pharmacy can really help you educate your community. But I've said enough, and it is now, Saya, your turn. I look forward to hearing your comments. Thank you.
Thank you, Lara. I'm going
Helen,
to
you'll have
share
to
my
stop
screen.
sharing.
Yeah. Okay. Does everyone see my screen? Okay.
Yes.
All right. Okay. Hello, everyone. I'm Dr. Saya Han, and I'm a population health pharmacist at Nova Script Central. And we are an award-winning nonprofit organization that engages with the community to empower people to make better healthcare choices. And at NSC, I lead our vaccination efforts, and we focus on really working on vaccine advocacy with various stakeholders in Virginia and across the country. And one of the vaccine programs that we are part of is a school-based immunization clinic where we see a lot of families who are immigrants who have recently arrived to the US. And they are facing a lot of challenges in accessing healthcare services. And because I also come from the same background as an immigrant and also a minority group, I understand all the struggles. And that's where really my passion is, to be able to be out there and share the knowledge that I have and to provide any assistance that they may need and really overcoming that barriers to healthcare system, including vaccination, which is why I'm here today to talk about some of the barriers that patients may face when it comes to vaccination and some of the strategies for overcoming these barriers. So when it comes to barriers to accessing healthcare system, we are probably familiar with social determinants of health. But today, I will be focusing specifically on some of the barriers that I've personally witnessed over the course of working with the community, especially underserved patients. So first barrier I would like to address is misinformation. Misinformation has been a significant barrier to vaccination, especially today with all the social media. There's a lot of people seeking out for advice on social media like Facebook, Twitter, TikTok, which can be very dangerous. When false or misleading information about vaccines spreads, this can create fear and doubt in the minds of individuals and communities. And this misinformation can take so many forms, such as exaggerated claims about side effects, unfounded conspiracy theories, or even distorted data that misrepresent the safety and efficacy of vaccines. And to address this, we really need to focus on listening to and analyzing misinformation that are circulating in your community. And we need to share accurate, clear, and easy to find information that addresses common questions to correct that misinformation. And rather than engaging in arguments with these individuals who hold anti-vaccine views, we need to focus on providing scientific data in a calm and respectful manner. And so ultimately, it comes down to really education, because the more they know, the less likely that they'll become victims of misinformation. And this is very crucial, especially this year, just like Dr. Yabo mentioned earlier, that we're switching to trivalent vaccine. And we need people to not misunderstand the reason behind why we're switching to trivalent this year. And we don't want people to start thinking that flu activity has become better, and we don't want them to loosen up on vaccination. So we, as a healthcare provider and as a health advocate, we need to educate on the continued importance of vaccination and emphasize that trivalent vaccine is what's essential this season for protection. So moving on to the next barrier is language barrier. People with low English proficiency may struggle to find accurate and reliable information about vaccines, such as their benefits, risks, and where to get vaccinated. They may also struggle with communicating with their healthcare providers and understanding some of the medical advices or asking questions about the vaccines. So in order to combat this challenge, we need to make sure that we're offering educational materials in multiple languages, and not just in translated form, but we need to make sure that they are easy to understand because I've realized that not everyone is literal in their own language. So we need to make sure that we're getting the points across them. And if possible, recruiting bilingual staff and or volunteers to assist with vaccine clinics will really help. And addressing the language barrier is vital to increasing vaccination rates in the US, because we are a country with so many diverse communities and many non-English speakers. And according to the report by KFF, about half of immigrant adults in the US have limited English proficiency. And about half of immigrants with limited English proficiency, they have faced language barriers in a variety of interactions, including accessing healthcare. So we need to be making sure that we address this barrier. Now, next one is low health literacy level, which ties in with the language barrier. People with low health literacy level may struggle to understand complex medical terms and vaccine-related information, which can then lead to confusion, hesitancy, and misinformation. People with low English proficiency are more likely to experience low health literacy, but even for people who are fluent in English, this can be a barrier for them as well. And in order to address this, we need to ensure that all the educational materials that are being provided are in written, easy to understand language. And when possible, we need to make an extra effort to have verbal communication about the vaccine and the benefits of it. And when possible, offer assistance in completing forms. So for example, at the vaccine clinic where I work at, I try to offer assistance when patients are completing their contraindication screening questionnaire form before getting vaccinated. And as we go down the line, if there are any terms that the patient is not familiar with, I will try to address them at that point to make sure that everything is delivered in a clear way. And it's really about creating that shame-free environment where patients feel comfortable to be able to ask questions that they may have. Now here on the screen is an example of an infographic that we made that covers some of the symptoms of the respiratory illnesses. And it was translated into 5 different languages, and not just translation, but we incorporated a lot of visuals so that way any reader can understand the message without any issues, even if they're not, even if they have low health literacy. And another challenge that I often face at our school-based immunization clinic is helping parents understand the necessity of certain vaccines for their children. So as I mentioned, many of the families we see at the clinic have recently moved to the US and they bring vaccine records from their home countries. And my role includes interpreting their records using the resources we have, including this toolkit right here seen on the screen that we developed to help us translate some of the foreign vaccine terms on their records. And once we translate that, we would determine what else do they need to get in order to stay up to date based on US vaccine schedule. And occasionally families would question why a vaccine is required if their child received it already abroad. And in these cases, I'll explain that different countries have varying vaccine schedules, and to ensure that their child is protected, we need to be following the recommended schedule here. Okay, now next one is associated cost. Even if the vaccines were provided for free, there are other barriers that the patients may face. And some examples include transportation, taking time off of work, childcare. And in order to address these problems, there are some steps that we can take. We can try synchronizing vaccines with routine medical visits. We can allow patients to address multiple health needs in one appointment. And we can offer vaccines at workplaces during lunch breaks, so they don't have to leave their workplace. We can host mobile vaccine clinics to bring out the vaccine to the community and offer incentives like gift cards for getting annual vaccines. These are all strategies that we can try to help make vaccination more accessible and efficient. Now, lastly, last but not least, lack of awareness of resources available can serve as a barrier. Even if there are wonderful resources out there, if patients don't know about it, if the providers don't know about it, they're not going to be able to share, and we're not going to go anywhere. So it's very important that we try to improve our communication and outreach efforts to ensure that everyone knows how to access vaccines and where to find reliable information. There are many other barriers besides the ones I mentioned, but whatever the barrier may be, it requires a comprehensive approach that includes outreach, education, and efforts to build trust within our communities. And this leads me to introduce our Community Pharmacist Ambassador CPA program, which focuses on empowering pharmacists to play a crucial role in public health. This program offers virtual, online, and interactive education about the current influenza season, along with strategies for effectively communicating with diverse and underserved population. And once the pharmacists are trained through the modules, they can then become ambassadors, and they'll be equipped to go out to the community to hold presentations and educate others using the resources that are provided to them. This initiative was designed to bridge gaps in communication and ensure that accurate, accessible information about influenza is reaching all corners of our community. And you can sign up for this program on NAQF website. And I think Lara also posted a link to the CPA program on the chat. According to the Gallup poll from 2023, pharmacists were ranked the top 10 most trusted professions in America, with direct access to and deep knowledge about their patient population. So this tells us that we are in a good position to serve as educators, advocates, identifiers, and immunizers. On the screen, this graph shows where most people got their flu vaccines for 2 flu seasons. And you can see that many people got their flu vaccine at the pharmacies. So this is another reason why we are at the best place to be really out there and be educated to be able to talk to our patients about the importance of getting vaccinated and staying protected. So please sign up for the program. Okay, and
Say thank you. I love the 3 E's that Helen brought up. Every patient, every visit, every recommended vaccine. I think I got that right, Helen. We are at time. I put in my email address and other links into the chat. So, and we will make available, I already put my slides into the chat. So just reach out. Any other questions? If you want to participate, go to the link or email us, and let's all stay safe this flu season from RSV and COVID and flu. Bye now.